Following President Cyril Ramaphosa's unveiling of the COVID-19 vaccine rollout plan during his address on Monday, provinces have to also give details of their programs. Yesterday, KwaZulu-Natal Premier Sihle Zikalala presented his province's distribution process. He identified the first targeted beneficiaries who, as we know, are healthcare workers. This national strategy will be implemented in 3 phases. Let's discuss this now and the rollout strategy as well as all of its guidelines. We're joined by Dr Angelique Coetzee, Chairperson of the South African Medical Association. Dr Coetzee, good to see you. Thanks for joining us.
Good morning, and a good morning to all your listeners and viewers out there.
So what do you make of the overall guidelines for distribution as they stand?
The overall guidelines, especially on paper, looks great. If you look at it on paper, it seems workable, and it seems the right strategy is being followed on that. The problem is going to lie with the implementation. I'm always saying at the coal face, where you have the patient coming in, and the hospital and the person who needs to administer the vaccine. I think there is where our problems is going to arise. From what I have seen, and I have seen especially the Northwest program, and it's a good program, a good rollout. It is important to understand that from the biovac labs, the vaccines will be directly distributed to the identified family clinics and hospitals. So it's not every hospital, it's not every clinic. They will then be sent. There will be police presence on the road, and also when it is being administered to the patients, there will be police presence. So that's more to prevent anyone from stealing it, or if there's any corruption, hopefully they would be able to pick it up in that process. However, this is extremely going to be difficult, as this vaccine is being stored between 2 and 8 degrees Celsius. So you need to have your fridges daily temperature to make sure, and you need to record it to make sure that the temperature is not going down. You need to make sure that you have a generator, because we all know that if, we know the poorage of our power, that's important, because if you lose the temperature, you will lose the efficacy of the vaccine. Then once if you take that vaccine out of the fridge.
How long? I mean, that is a question. So if in fact it is the lights go off, the power goes off, somebody takes the vaccine out of the fridge, it's not stored at that temperature, how long is the kind of shelf life of that vaccine out of the storage temperature?
Well, it should not get out of 8 degrees. That's the problem.
Okay.
So that's the one problem. You should keep it between 2 and 8 degrees. That's why if you take it out of the fridge, you need to put it next to you in a cooler box with the right. Which also needs to have the right temperature.
Yeah, and almost immediately it has to be given.
That's the problem.
So once you take it out of the refrigerator, it has to be given. So at 8 degrees, when you do administer it, is that the temperature that you should be administering it into somebody? The highest temperature?
That's the highest, the storage temperature. But there's another thing.
Yeah.
It is light sensitive. So 6 hours. So if you take that out of your cooler box, and it's cold. Let's say it's cold today, and it's 6 to 8 degrees, and the room is cold, and there's an aircon in, and it's the room temperature is 8 degrees, for argument's sake. But you leave it out in the open for more than 6 hours. It would also not be effective anymore, because it's light sensitive. You've got a 6-hour window period, and then you need to use it in that 6 hours after it starts, after it is exposed to light. So, and this brings us to another problem, and this is where I would urge our people out there. Once if you get your appointment with a time, you have to be there at that time, because they work it out per vial. you can, between 8 to 10, we say 10, but we think 8 to 9 people will be vaccinated by one vial. They take a spillage into account. So they have that vial can for only 6 hours to be out in the open and in the cooler box for up to 8 degrees.
Okay.
So if you do not come on time, you might not get vaccinated.
Yeah.
Because we cannot keep the vaccine for you, so for whenever you decide you're not going to pitch up. And we're notorious for not being on time. So that might be a huge problem. And you cannot just rock up at the clinic and say, here I am, I'm Dr. Coetzee, I want to be vaccinated.
Yeah,
it's not going to work like that.
Sounds like it's a strict process. I'm going to throw a couple of questions at you because we've got a lot coming through and we don't have too much time. But, you mentioned that if anything goes wrong, obviously with the vaccine, whether it's, it's light sensitive, the temperature has changed, then this vaccine is administered to you. How do you know if it has been an effective vaccine or not as an individual, because something may have gone wrong in the process and you are absolutely not aware. You've been ticked off as having the first dose of the vaccine, and yet it was actually a messed up vaccine that wasn't really administered properly.
That's now the big problem. There's no way. You will only know if that people that you have vaccinated with that specific vial in a few months from there on start to get sick, and you can trace it back to when it was administered, and then so you will have to work backwards, but only after the patient got sick and a few months later. There is no way, there's no discoloration, there's nothing on the vial indicating that this vial is not effective or this vial is being compromised. And this is where I see the problems is going to arise.
What about training of healthcare workers? I mean, have they been trained? Because, in countries where obviously this has already started, the rollout, whether we talk to the US, the UK, Israel being a great example, the United Arab Emirates, I mean, these countries they've encountered other problems that perhaps we're not looking at. I mean, the needles, the vials, the training, because what you're telling me now, this is an expertise that is needed to administer this vaccine, keeping it at the temperature, making sure it's not subjected to light unnecessarily, that it is given timeously. Do you know about training that's currently being taken place?
There are training sites that is currently taking place. There is a training program even for doctors. It is online. It's an online program that you can apply for and do the course. Hopefully, as per my knowledge, there are training in the public sector on nurses, but I'm not sure whether they have employed. Because to some of their calculations, they still need more healthcare workers to be trained. I think it's about between 12 and 15 per site that need to be trained for this.
Yeah, all right.
I'm not sure whether that started because I know there's a financial problem to employ these people. Also, remember there must be transport arranged as well, so it's going to be quite tricky.
Yeah, there are a lot of logistics that come with this. This is now we're talking to the AstraZeneca vaccine, which we are, believe it is going to be administered to healthcare workers. I'm going to talk to you about categories in a short bit, but while we're talking about vaccines and administration thereof, I mean, the Pfizer vaccine is a big worry because we've also been led to believe that we have secured some doses of the Pfizer vaccine, but this is that vaccine, the infamous vaccine that needs to be stored at something like, what is it, minus
70.
Minus 17 degrees. How are we, 70 degrees, how are we possibly going to do that?
Well, they say they're going to use certain packs that's been developed that would keep it cold. But, I think that's actually the best vaccine. But before we get to that one, we still need to figure out the problems that we have with this between 2 and 8 degrees. And as you correctly said, the dosage is 0.5 milliliters. It means you need actually a diabetic syringe to to get it out of the vial, because 0.5 mils it's minute. It's not a lot. So there's a lot of other things. You are absolutely right. We haven't even come to that. We are aware of that problem that's also lurking in behind the scenes.
Yeah, which is a big thing, because I mean we've heard the news that we've ordered 20 million of those vaccines, so we need to work fast. But let's focus on the here and now. So we've seen these vaccines that have landed here in South Africa. They're being stored. They're now looking, going through all these health protocols. The online database is happening. I know I saw a lot of people trying to register, but only people that are in the medical sector and frontline workers can register right now in this portal. But what are the preferences that are being given? Because the amount of doses obviously are not going to cover everybody. So what is the order of people that will be receiving them?
So, in the first group would be people who is in direct contact with patients that might be either sick or patients that is lying in ICU, patients that is lying in medical wards, patients coming into the casualties, patients at GP practices. That is also first line. They also you work you need to expect that each and every patient coming into your surgery might be a possible COVID-19 patient. So those are the people who is in direct contact on an everyday basis will be the first in line for the vaccine. And then you will taper it down and you will go a little bit further, and you will say, okay, for argument's sake, you're now going to go to nurses and doctors not working in those medical wards, but more in surgery, for argument's sake. Then you go down and then you say, okay, now we need to also vaccinate the cleaners. We need to vaccinate all other people in a healthcare facility. And so you will go down until you get to people in a facility who is actually not in direct contact with a patient, like your auditors, your bookkeepers, your support staff. And that would be the people who would then be vaccinated last in this level 1.
In this level 1.
Also, important to understand that I think the numbers is around about 800,000 in healthcare workers in total. So we got 1 million. So we're not going. We do have enough for the first phase. The second phase will only for the first injection. The second injection would only happen 3 months later.
Now, this is where my concern comes in. I was reading about Israel and how Israel have embarked on this. They say that, after 2 weeks, you start seeing the vaccine taking effect. Then, within 3 weeks of the first dose, that's when they give the second dose. And now they are seeing cases dropping dramatically, and this is where they're feeling confident that it's actually working. Now, it's quite a concern, and perhaps you can explain this to us. Maybe they're using a different vaccine that needs to be administered. So that is the difference. So the vaccine that you receive, this AstraZeneca vaccine that medical professionals will be getting, will they receive the same vaccine, the AstraZeneca, 3 months later? Is that the understanding?
Yeah, that's the understanding. That's the studies. I think they are using a different one in Israel. I'm not sure. I think it's Pfizer. Most of the first world countries are also using Pfizer, and that's 3 weeks later. But we're not using the Pfizer one. We are using the AstraZeneca one. There's a difference.
Okay, so that's an important point to note as well, is that 3 month gap. However, we need to secure those vaccines so that obviously if you don't get it within the 3 month period, how effective is that going to be, and would we have wasted all of those vaccines if we don't get it in time to administer the second one?
Well, you will have a bit of a protection. It would be much more feasible to get the second dosage, as that is how they did the studies on. But even if you get it 4 months later, it will still be effective, according to the studies.
Okay, good.
But we are talking about the AstraZeneca one.
Yes,
please,
indeed.
just
that's
so that people know.
we need to be very clear on that one. We are not talking about any other brand of vaccine. It is AstraZeneca,
Yes.
what is in the country and what is going to happen. I want to talk about this online registration. How's it going so far? Have you seen, I imagine, lots and lots of medical professionals that have jumped on there and registered? Some are complaining there's still no clarity for them, but perhaps we can help them out. I mean, maybe give out that website address and also update us. How's it been since it was launched?
Well, I think it's quite well received by most of the healthcare workers. I know that they are trying to register online. SAMA's got a website which we vaccines for healthcare workers, where we ask our doctors. There's more than 2,000 GPs already registered on that, and that we would try to integrate that with National Department of Health system, so they don't need to re-register themselves. But I know there is some people of the doctors that was complaining about the categories, and we did escalate that to National Department of Health, and they promised to look at that. And I think there's quite a willingness, especially from National Department of Health, to try to make sure that this is going to work. But they can only do that much. Provinces must do the rest. And in the end of the day, it's going to depend on the provinces, how they handle this and how they incorporate the private sector into this vaccination rollout program.
Yeah. The president has said that there obviously is absolutely no way that any South African will be forced to take this vaccine. As far as you know, any medical professionals that do not want to take this vaccine, and their rights obviously will be respected if they don't want to take it.
That's a very, very difficult question that you're asking, because the president said that each and every one, it's your choice whether you want to take it. But from an ethical point of view, there was a whole discussion on this. Ethically, as a healthcare worker, there might be a problem if you refuse to take it. So I don't really want to go into the details of this because, the presidency says something and on an ethical level there's a different opinion. But maybe that's something to explore, and maybe people who know a lot about this would be someone like Prof. Ames Dye. Maybe get her on to explain to the public how this works. So yes, there's unfortunately also a lot of medical doctors that that contacted me, and they at this stage doesn't really want to take the vaccine. And again, as the president said, it's their choice. But I also had to remind them of the ethical side of that, which I don't want to go into.
No, absolutely, and that's, I think, another conversation we need to have. We need to keep talking to you, Dr. Coetzee, but I've got to wrap this now. But I think this has been very, very enlightening. Thank you so much for joining us. Dr. Coetzee is the chairperson of the South African Medical Association. Got the link. I'm actually going to just tweet it out there, just in case you have missed it. We'll put that out there of where medical professionals go. That is, I think, a portal that we're all going to use eventually to register for the vaccine. But right now, I know a lot of people have tried, you need to be in the medical fraternity to register right now, nothing else. All right.
And I think that's going to be key, how information is disseminated, so you don't have people clogging and hogging spaces that others actually need to access. So right now, no. Unless you're a medical professional, no.
Just leave it.
Unless you work in the healthcare sector, because even then it will be staggered how they will actually roll it out.
All right, we got to go. We've got to say goodbye to SABC2 viewers. Thank you for watching.